Hi everyone, Dr. Nemechek here. I want to talk about sudden hair loss. Now, I'm not talking about stuff that happens over a long time or male pattern baldness. I'm talking about like going along and you notice within a week, last week or two, boy, lots of hair. Like when I'm brushing my hair in the comb, or women will notice it in particular. They take a shower and they're brushing their hair out and they're going to have some hair in there normally, but this is a lot. And it tends to happen kind of suddenly. Now, if this is occurring, one thing you need to do is you go to your primary care doctor and get some basic labs. You want to make sure your thyroid's okay, iron levels are okay, some basic stuff like that. And just not to miss that kind of stuff. Another common source of this is intense stress. Intense stress. It's called Telogen Effluvium, and you can have a rather sudden loss of hair. Now, the good news is once the intense levels of stress decline, the hair will come back, okay? And then a very common one is inflammation, a sudden bump in inflammation. And what we've seen a lot is after COVID. And because if you have just, say, influenza and you get a bump of inflammation and it goes away, it stops and the hair will, growth will resume normally, then you might not even notice that you have much hair loss. Okay, it's this chronic inflammation that occurs, and that can occur kind of if you think of, I got sick with COVID, and then I had this hair loss afterwards. Maybe it's like a long COVID effect is from prolonged inflammation. All right, from that. Now, the other problem is so many people, you can have this persistent inflammation after COVID, even when the COVID infection was asymptomatic. Okay. So anyhow, case of a woman was feeling fine, gets COVID, thought she got over it, and then had this rather intense hair loss. And so after COVID, she also developed some gastrointestinal symptoms, and which were suggestive of SIBO, or bacterial overgrowth. So we put her on some continuous rifaximin, and because of the COVID, we also put her on glutamine. And again, I've talked about COVID causes a very different form of leaky gut than that is found by SIBO, and you have to kind of think of treating each of these independently. But when we did that, she said, man, 8 weeks, stopped. The hair loss just stopped at 8 weeks. And so you can shut this off, and you just got to look for the inflammation. Now, if you didn't have COVID and you're like got some digestive stuff, certain foods, you're intolerant to certain foods, you might have just picked up SIBO, and that's the cause of it. And so you go in the protocol, and you would need rifaximin in particular for that. I should add also the woman was on fish oil and olive oil also. And so hair loss, sudden onset of hair loss, get your labs checked. Think about, personal intense stress, some medicines, but you'll know that. That'd be chemotherapy. That would be obvious. And then if not, you got to start thinking, I've got chronic inflammation, and the biggest source of that, is from bacterial overgrowth and leaky gut. And in addition to that, possibly is a COVID-related leaky gut that requires glutamine. And I think with that little kind of algorithm, you'll solve most of your problems. Otherwise, take care. Have a good day. Bye.